Hey, digital revolutionaries, welcome to TechnyFire, where innovation meets inspiration. I am dapoaruwajoye, the TechnyFire, and I'm buzzing to share what we're uncovering today. It isn't just cool, it's life-changing. Artificial intelligence has become a phenomenal force, and it's doing wonders in the healthcare sector, for spotting diseases earlier than ever before to delivering personalized wellness plans and virtual care. Today, we will dive deep into how advanced artificial intelligence is transforming healthcare delivery and personal health management, making care more proactive, accessible, and genuinely human-centered. But first, let's get up to speed on the latest tech news in our signature segment, Tech News on Fire.
OpenAI has partnered with Shopify and Etsy to allow users make purchases directly through ChatGPT. This integration enhances product discovery and streamlines the shopping experience, benefiting both merchants and consumers. Meta is launching its Metabot project, emphasizing software development over hardware in robotics. Led by CTO Andrew Bosworth, the initiative aims to improve robotic capabilities, including household tasks, while continuing work on augmented reality glasses. Techwise has created a humanoid robot capable of moonwalking and dog walking at speeds of 12 km per hour. Designed for stability and human-like proportions, it cooperates advanced AI for real-world applications and will be showcased at upcoming robotics conferences. Xiaomi has unveiled the Xiaomi 17, priced at $630, targeting the iPhone 17 market. With features comparable to Apple's models, Xiaomi aims to increase its share in the premium smartphone sector. Bitcoin's price has risen to more than $112,000 after previously dropping below $109,000 amid concerns about a Federal Reserve policy shift. Predictions of nation-state rushing to build the Bitcoin reserves add to market speculation. OpenAI has planned to build AI data centers in collaboration with NVIDIA that could consume up to 10 gigawatts of electricity, comparable to New York City and San Diego. This raises concern about the environmental impact of such energy demands in the AI industry.
Welcome back. Now, let's set the scene and examine AI-driven digital health platforms, how they detect risk early, tailor prevention and treatment, support mental well-being, and connect patients with healthcare providers through telemedicine.
Historically, healthcare has often been reactive, with patients depending on symptoms to seek assistance, which resulted in delays in diagnosis and treatment. Today, AI-powered wearables continuously monitor health in real time, identifying risks early, such as irregular heartbeats or spikes in blood pressure, before they escalate into emergencies. Mental well-being has become a priority as well. AI tools provide mental health support by offering resources and connecting individuals to care, ensuring a holistic approach to health management. Additionally, telemedicine allows anyone to connect with healthcare providers from the comfort of their homes, breaking down barriers to access. Shifting from a reactive to a proactive model, today's healthcare empowers individuals with knowledge and support, paving the way for a healthier future.
To understand how AI is transforming patient care, we welcome Odunola Oyegade, a leader in reshaping healthcare in Africa. With over 25 years of experience, she founded Hexia Health, a digital platform utilizing AI for early disease detection, personalized wellness, mental health support, and telemedicine. Join us as she shares her journey and Hexia Health's mission for universal proactive care. Welcome to Trailblazers on TechnyFire. We're glad to have Odunola Oyegade, a professional with over 25 years experience in the healthcare industry. She is the founder of Hexia Health, an innovation that uses artificial intelligence to transform healthcare delivery and personal health management. She has a lot to say about artificial intelligence in healthcare. Thank you very much for joining us on the program today. So let me start by, let's know you better. Let me start by asking, who are you? Let's get to know your background.
My name is Odunola Oyegade. I'm a pharmacist. I finished 35 years ago from a pharmacy school in Ahmadu Bello University Zaria. So I'm a Nigerian graduate. Let's settle that first. Yeah. So I went to a pharmacy school, and I think the journey started with a very clear intention. I love my profession as a pharmacist. But I think as I started into the pharmacy world, I started more as a community pharmacist, and which allows me to kind of meet a lot of people. And when you meet people on one-on-one, you tend to get involved with their issues, with their health issues, with their medication issues. And I think the first thing I wanted to do was, how can I prevent certain things? How can someone be better? And I got into supplements. I started training myself on how you can live better, feel younger, be energetic, just, taking supplements. And I started discovering how to treat people, using supplements. So I think my journey as a person is also that I love to provide solution anywhere. I'm a mother, I'm a wife, I'm an entrepreneur, I'm an event planner, I'm a fantastic cook. So I think I was brought up to know that there is nothing I want to do, that I put my mind to do, I cannot achieve. So I think that has shaped who I have become over like how many decades? Like 3. But my interest in healthcare came from that background, in wanting to make sure people feel healthy. I live in Nigeria. If I tell you that I've not had malaria in more than 20-something years, you will say, how come?
How come?
Exactly. Because I always want to find a solution. This is possible. How can it be possible? And so in that process, I developed a solution mentality. So I'm a solution provider. Anywhere you put me. Whether you put me in church, in the pharmacy, just put me anywhere. The first thing I want to say is, what's that? How do I provide a solution for anything that I see? And I think that has been a major foundation of my healthcare journey. I grew up with a brother who, is an uncle, but we were like brothers, because he was like my mom's firstborn, not like my mom gave birth to him. And so he read medicine. And so I've always been, with him, we will talk about medicine, then I read pharmacy. And so I've always been in that healthcare space where, how do we solve people's issues? And I think in my own little way, in the pharmacy, I did that. So sometimes I see a cancer patient and I say, well, how come their hair falls off? Can we not do something about their hair not falling off? And I discovered something, for a patient. There's some things they will say is not treatable. Or they say it's not possible. Somebody, the moment it's not possible. And then I start to discover there are certain things you can do to prevent certain things. And I think that's my foundation.
So how did you find yourself in the tech ecosystem?
That's a very interesting one, actually. But I think it started from a lot of deaths around me that I know that I felt were preventable. I think I had, it was just too much, and It wasn't like maybe my sister or there were just too many. No, when you're in the pharmacy, you hear certain things. You have people you have gotten close to, you have friends, and I just saw a lot of that, and they were all preventable deaths. And I feel, okay, what is making people wait? What is making people wait to the last minute? Why do I have to wait to the last minute before I go into the hospital? Why do you discover that I have stage 4 something, or I have a serious medical issue at the last minute? Always at the last minute. Oh, I didn't know that this person was sick. But I saw him yesterday. I still had one last week. He said, but I saw him and he just suddenly went into a coma. By the time they checked, his BP was very high and they didn't know. So there's always that thing in this ecosystem, in the healthcare ecosystem. So most of the cases we see that are dying, they are preventable. And so, like the usual me, always looking for a solution. What were the problem? Why are people waiting? Why do we wait? Yeah, I think I should ask you that. Why do you wait? If I have headache, I'm busy. It's just headache. I'm tired. Right? So we explain it away. I'm just tired. Then we go to the pharmacy. Can you give me Lexotan? Can you give me something to make me sleep?
Self-prescription.
Self-prescription, without even knowing anything. We take paracetamol, and then we feel that that's all we need to do. Or we explain it away. I'm just tired. By the time I sleep, I'll be fine. The headache is consistent. Still the same answer. I'm too busy. We're always too busy to attend to our health. We're always too busy. That's number one. The second, it's not convenient. You know, by the time the traffic I will take to get to the hospital, then the major one, the cost of the healthcare. So this were all analyzed. Why do people wait?
So what has changed really when we talk about technology? What has changed? Because 25 years, you must have seen it when there wasn't tech.
There wasn't anything. I think what I would say is I'm a very inquisitive person, and I don't believe that age is a barrier in anything. So anything that goes on in the world, I like to know. But in looking for that solution, I realized that the best thing to do, especially to make it easier for people to access that care in a convenient manner, was to put that thing on the phone. That if I give people an access that will remove that I'm too busy. So you can be at your working place, right? And I can tell you, why don't you can just have Hexia Health on your phone, right? And then you can access your healthcare whilst at work. That means I've solved one. The second is, I don't know what is wrong with me. I have headache, but I can't go to the doctor. Then the AI symptoms checker, that when you have headache, type your headache. I have headache. And in 3 minutes, you can have the AI give you. The AI does not give you a diagnosis, but can say, oh, this might be a likely issue. You need to speak to a doctor instantly. And you are still at work. This cameraman can just be off in 5 minutes after this meeting and still be able to access healthcare, right? So we didn't just build a system on your phone. We connected the ecosystem. What do you need when you go to the hospital? You need a doctor. You need a lab test sometimes. You need medication. Then you have tools that will make you to be able to comply to those things and be well. So the most important thing is the patient outcome. So we put everything together. So Hexia Health, or that technology, is not just about anything. It's to just provide health care to you in a more accessible, convenient way that will not make you to run, and that will give you access to be able to get to that point where you don't have to wait till you know what is wrong with you. But being in tech, what has changed? How will I put it? The world has changed. The world has changed. Generally. And so when you look at what we do, why are we not changing to make it better? Why are you here today in this whole place? Everything has changed. It wasn't like this 25 years ago. It's made better. So we can also give the same thing to healthcare to make people live a better life and not just die when it's not necessary to die. Or when it's not, things that can be preventable.
When it's not necessary.
Yes.
You're right.
Yeah, why should you just die because you have diarrhea? Why should you die because you have malaria?
Preventable death.
They are preventable deaths. Why do you have hypertension and you don't even know that your blood pressure is high because you don't have symptoms other than a little headache? And we don't have time to do that, to attend to it. Everybody's busy. Since morning now, if I ask, and how many people, we've all been running around. But this thing is there, that whether in your car, in your office, in your house, anywhere you are, that is what technology is giving us right now. The world has changed, and so healthcare has also changed, that we can access healthcare without necessarily being a building.
So what motivated you to found Hexia Health?
What we found out so far is there are so many. I will talk about the last few days or the last 2 weeks I've been here. I've had about 5 deaths in the last 2 weeks, and all the deaths were preventable. And everybody has been angry. And so the moment I told the first person, because we just started, right? We just even started social media in July. We launched on the startup conference, but we basically are just coming out fully with what we have, because we wanted to ensure that we cover from the beginning to the end all these problems. But yes, so that we don't miss anything. But I can tell you one thing. The moment I talked about this to somebody, and he said, my brother didn't have to die. And I said, yes. And I told him he said, wow. He said, this is what everybody needs. As I'm talking, we're going to be there on Tuesday. He said, because even me, I do not know the health nature of my community. He said, so how then do you manage what you don't even know? So that is number one, that people are looking for this because they did not even know it exists. We're here today because we want to talk about it, that this exists, that you don't need to go through that journey that these 5 people went through, or that I went through, or anyone that has gone through it, that you don't have to be at the end of the issue before you actually get to. They are preventable. So you can live a very well, I call it wellness life. Wellness lifestyle with good information, with preventable actions. I call them lifestyle, but they are preventable, that will make you. For example, if I have headache now, I don't go popping Panadol. I will ask myself, what did I do in the last few days? Why am I having headache? I can ask. Yes, you can go to Hexia Health and say, I have headache, and it will prompt you to all the points. It will just ask you in 3 minutes. It will ask you whether it is you. It will ask you what kind of headache you're having. Is it frontal? It will show you pictorial heads for you to pick which part of the head is paining you. Now, when you pick that, it will ask you whether did you hit yourself? What happened? Did you fall down? You understand? Then it will ask for your age. Then it might ask whether you've been sitting down or lying down, or whether there's any other symptoms you're feeling. And then after that 3 minutes, it will give you like 3 possible options. And it will also give you the severity level of what those issues are. Is this something that needs you to go to the hospital right away? But immediately it will also ask you. You have an option to speak to a pharmacist or a doctor. And then you pick, I want to speak to a doctor. And it connects you immediately to speak to a doctor. Now, the moment you're speaking to a doctor, the doctor will have seen what you have filled based on, all your questions. And so it helps the doctor. Before you see that doctor, it will have helped the doctor to be able to know what you're coming with.
For those who don't know, what is telemedicine?
Telemedicine is that you have access to doctors through virtual consultation. So that is what you now do. So the moment you say, I want to speak to a doctor, you're speaking to a doctor face to face, but virtually, not physically, but virtually. But it gives you the same feel as if you are in front of the doctor, because the doctor is looking at you.
Do you foresee challenges in the future when AI takes over our health?
No, I don't say that AI is taking care of your health, right? But AI is making you to quickly, I call it for early detection, is making you to quickly attend to your health in terms of asking questions. So your interact is like a medical support. So you're interacting with someone who is asking you questions. So it's making it faster to get those information before you see the doctor. So I will not say that AI is managing your health. No, AI is just making it faster to get your information for the doctor to give you the care.
Is it affordable?
Okay, so now, you know what I said at the beginning? I said that at the beginning that one of the major issues with healthcare is cost, correct?
Yes.
Now, I think that was one of the major things that we looked at in bringing out this. To have a subscription is $3,850. That is affordable, and you have it right on your phone. You can access a doctor. The beauty of this is by the time we look at that, if you're talking to me on digital and I finish talking to you, if you have to go to, if you need a specialist, right, you still need to go to a hospital. So what have we done? We have integrated health insurance into our product.
Thank you so much for joining us, madam. Okay, that's all we can take on Trailblazers on TechnyFire with Odunola Oyegade, a professional with 25 years experience in healthcare and also the tech industry. She's the founder of Hexia Health. And you can download Hexia Health on Play Store and iOS. Welcome back from that inspiring conversation with Odunola Oyegade. After the break, we will share practical Techwise tips for both patients and healthcare providers navigating the world of AI-driven healthcare. Few are familiar with the iconic yellow and black Where There Is No Doctor by David Werner. Once an indispensable medical reference in pre-internet days, now AI has revolutionized healthcare, shifting our approach from reactive treatment to proactive prevention. AI-powered wearables monitor health metrics and detect falls, potentially saving lives. Telemedicine connects remote patients with urban specialists, eliminating geographical barriers. AI algorithms analyze medical images with precision, often surpassing human capabilities. For chronic conditions, AI tools offer medication reminders and symptom tracking, enhancing accessibility and personalization in healthcare. While Werner's book, Where There Is No Doctor, was a groundbreaking then, today's AI health tools empower individuals with medical knowledge just like never before. Therefore, embracing this technology is vital for a healthier future. So be wise, health-wise, tech-wise. Thanks for your responses from previous episodes. They keep this vital conversation alive. Today's burning question: have you used AI-driven health tools like telemedicine, symptom checkers, or wellness apps? How did they affect your care experience? Share your stories at www.technyfire.net or dapoaruwajoye at technyfire.net or on our social media platforms. We read every message. That wraps up our exploration on Hexia Health and the transformative impact of AI-driven healthcare. We have seen how these technologies can deliver earlier disease detection, personalized care, mental health support, and convenient access to clinicians. I hope this episode has equipped you to navigate the evolving healthcare landscape with confidence. Don't forget, if you know of an inspiring tech innovation or an innovator making a real difference in people's lives, please reach out to us. We are always excited to share groundbreaking stories with our global community. Until next time, keep the tech flame burning bright. I am dapoaruwajoye, the TechnyFire, signing off and saying see you next time on TechnyFire.